Hi, my name is Clarinda Stolzfus, and I chose to do my presentation on mindfulness, the art of focus. So the history and origin around the practice of mindfulness came from the Buddhist religion, and historically the culture and people that surrounded this practice were from India and Nepal. Both countries are still heavily Buddhist as far as a religion goes, and this practice is very common. It had been practiced for thousands and thousands of years related to a religion, specifically the Buddhist religion. Now it is practiced, mindfulness is practiced not in relation to any specific religion. And how it was more introduced to Western medicine and to America was through John Kabat-Zinn. He founded the Stress Reduction Clinic and the Center for Mindfulness in Medicine at the University of Massachusetts in medical school in 1979. He also is responsible for creating the cognitive therapy mindfulness stress reduction programs. There's two different specific therapies that he really is known for. Going along with just the origin of mindfulness and its practice, I put up this picture. This is in regards to the Buddhist religion, and there's several things listed out here about just being in right thought, having right understanding, right mindfulness. So these are a few things that mindfulness can be related back to in the Buddhist religion. So what exactly is mindfulness? It is the art of focus, being in the moment enough to control your thoughts. According to the book that we are going through for this course, mindfulness is the opposite of living on autopilot. It is the art of conscious living by focusing full attention on the activity at hand. It really is the idea of becoming introspective and thinking through your thoughts, being able to process life in all of its busyness, just taking some time to focus your thoughts and consider what you're thinking, letting go of the negative thoughts, thinking about the positive. So how does it work? Instead of listing out bullet points of exactly how it works, I just put this picture up here because I thought that the picture was interesting in the fact that it says breathe and it also kind of looks peaceful. With mindfulness, there can be certain like breathing patterns that you do or yoga moves. So it's just something that I kind of thought encapsulated the idea of mindfulness. And how does it exactly work? Well, it works by focusing your mind and controlling your thoughts. It helps one be present in the moment and significantly self-aware so that you can let go of negative, unhealthy, frustrating thoughts, and it works by allowing you to be introspective and let go of stress or thoughts that are overwhelming you. So the benefits and contraindications of mindfulness, it helps improve your mood by decreasing stress, anxiety, and depression. It also helps increase your immune function. And I believe that happens just by being able to let go of stress. It actually helps lower your blood pressure and also lower your heart rate. Again, that is just taking time to let go of stress. Really, the idea of mindfulness is controlling your thoughts, letting go of the negative ones. And when you do it with certain breathing patterns, you can breathe out and think about just letting go of those negative thoughts and then retaining the positive ones. It also boosts creativity and strengthens brain function. And from what I read, it actually does have a neurological impact just by giving your mind the time to think through things and be creative, but also strengthen those neurological brain wavelengths. As far as contraindications to it, there's really no known contraindications to the practice. I will mention maybe a disadvantage in the next slide, but anyone can practice mindfulness. It is commonly practiced by and all people really. Advantages and disadvantages. Again, I just put a picture up here because a lot of advantages come from mindfulness and there's not a whole lot of disadvantages, so that's why I put in there #winning. Really, as I mentioned prior, as far as the advantages go, the biggest one is decreasing the potential for depression and anxiety. It gives a lot of people peace and calm. And then there's physical implications, like I had also mentioned before, in increasing your brain activity and strengthening creativity, bringing just that peace and calm. As far as a disadvantage, it didn't seem like, in my research, it didn't seem like there was any real research that supported disadvantage, but there was some blogs and articles that mentioned perhaps like an increase in a narcissism personality or an increase in judgmentalism. But the very fact of mindfulness is to be not judgmental in your mind and to let go of thoughts. So those were some things that I read, but not technically proven disadvantages to the art of mindfulness. The perception of mindfulness, really, in general, integrative medicine has become more and more popular here in the US, and the idea of holistic treatment, treating people's mind, body, and spirit, has become widely accepted as an understanding that we should not only be taking care of their physical bodies, but also their mind and their spirit. And many people practice mindfulness. The fact that it is so widely accepted here in the Western world does really stem back to John Cabot, who created those mindfulness therapies. So it is definitely a widely accepted practice. Also, there's really no known negative side effects that I'm aware of. It can be part of meditation practices and yoga. So it can be a standalone therapy, but it is part of the more holistic idea of spirituality too, and just being able to connect or have an experience, more or less. So it can be a standalone therapy, however, it is generally part of yoga or certain breathing patterns, certain stress reduction programs. There is a lot of research out there on mindfulness therapy. In fact, there's a lot of research talking about how it can decrease job burnout or maybe decrease addictive behaviors and patterns because you're more controlled in your mind and all of that. But the research article that I chose to just summarize here was a research article talking about how it helped cancer survivors. So 151 women were placed in a randomized control trial where some of them went to the 6-week program that offered 2-hour sessions of mindfulness, and some did not go to those therapy sessions. At the end, when they had to take a test to see how it helped them, and also 3 months follow-up, physically it seemed to decrease inflammatory markers that can tend to be higher in cancer patients. I'm not exactly sure all the inflammatory markers that they were looking at, but it's a good thing that they were decreased. It's related to the cancer. And emotionally, it increased feelings of peace and meaning for people. That's what these women reported. So I thought it would be interesting to just listen to a personal testimony from Jane about mindfulness and how it impacted her cancer journey.
I was diagnosed with breast cancer in 2004, and then I've had a few more lots of treatment for secondaries, and now I'm what they call metastatic breast cancer. I approached the course thinking that I would get more of a, not necessarily a structure, but an ability to sort of be able to manage those different thoughts and feelings, because I think the mind can take you to so many different places, and it's being able to recognise that and then sort of rein it in. It's beneficial with cancer because your mind, and particularly in my situation where the cancer has come back, your mind goes in all sorts of directions at all sorts of times, but by being able to recognise that that's actually what's happening, these thoughts are taking you to different places, then you can actually have a bit of, I wouldn't call it control, but you are actually recognising what's happening, and you can perhaps do something about it and lower that stress. But I'd probably explain it in terms of what I've got out of it, and that is that to be able to try and be present, you can actually then manage the fact that all these things might have happened already, and then things might happen in the future, but for the moment all you can do is be here. It sort of has that ability to be able to, whether you're a cancer patient or not, I think it's a useful way of being able to deal with life.
So that's a cool personal story of how mindfulness impacted her, who was still currently sick with cancer. As far as educational requirements, you do not need to be certified to practice mindfulness. Anybody can. There are a lot of year-long certification programs that you can take, or even a couple weeks in order to teach mindfulness. At least in my research, that is what I found. So my review questions for you are: number 1, what religion did the art of mindfulness stem from? 2, who was responsible for bringing the practice of mindfulness to Western medicine? And 3, what are 3 benefits to practicing mindfulness? So here are my references. I hope that you enjoyed this presentation. Thank you very much.